Alright, hey guys, Dr. Shook here. I just want to start off by saying that I literally have 10 minutes. Okay, so what I'm going to do is I want to explain this, which is a really important subject that not many people are aware of. Lately I've been doing a lot of these, a lot of my whiteboard videos have been revolving around hormones and gut dysfunction. And all of these things have a direct impact on some of the thyroid physiology, on transportation of your thyroid hormone, or sensitivity of your body to your thyroid hormone. So all these things are relevant if you're struggling with thyroid dysfunction, if you have autoimmunity, if you have hormonal problems. These are huge. So today what I want to talk to you guys about is I want to actually talk about how digestive tract dysfunction can cause problems with estrogens and cause you to actually, you can have very, very potent forms of estrogens that can be very dangerous just because of a bacterial imbalance in the gut. Okay? So let's talk about this because I don't have a lot of time, but I really want to share this with you guys today and make sure that you get this information. Okay? So how this begins is really if you have a gut bacteria imbalance. Okay, this is also called dysbiosis. You don't necessarily have to have an infection, but if you just have an imbalance in the GI tract bacteria, if you're missing some of the bacteria that should be there, or if you have an overgrowth of even normal bacteria, that's considered dysbiosis or an imbalance. Okay? So you could have an infection, and that could also promote this, but this gut bacterial imbalance, what it can do is it can cause you to have increased activity of something called beta-glucuronidase. Okay, all you need to know is that your liver is responsible for clearing estrogens from your body and putting it into your bile so that it can be eliminated through your stool. Okay, so I want to say that one more time. Your liver is responsible for taking estrogens from your body, from your bloodstream, putting them into the bile so that they can be eliminated with your stool. Okay? So here's the thing. Gut bacterial imbalance can increase activity of this thing called beta-glucuronidase. Okay? And all you need to really know is that this gut bacterial imbalance, it can contribute to this increase in beta-glucuronidase activity. Okay? So the easiest way to say it is, if you have an increased activity of beta-glucuronidase, what will happen is this gut bacterial imbalance will cause you, as you're breaking down your estrogen, normally you form these three different metabolites. They're called hydroxylated estrogens. Okay? We test these all the time. But as you clear estrogen from the body, you'll make 2-OH or 2-hydroxy estrogen, 16-hydroxy estrogen, and 4-hydroxy-estrogen. You make these normally, but these will be the importance here is the ratio. How much are you making of 2-hydroxy, of 16 and 4-hydroxy, and then how much are they relative to one another? Okay? When you have this gut imbalance and you have increased, and I'm going to say it again, beta-glucuronidase activity, okay? And in gut bacterial imbalance can cause increased beta-glucuronidase activity. What will happen is it can decrease, these forms, it can throw off this balance of how your body clears estrogen, okay? Gut bacteria can cause you to make more of this 16-hydroxy estrogen primarily. It is a potent estrogen. It's very potent, meaning that it has a much stronger estrogenic effect than just your regular estrogen. Okay? It can also decrease this 2-hydroxy form, which is the preferred way. It's the preferred way to eliminate it from the body. So you have less of the kind that you really want to eliminate. You have more of this very potent kind that can actually cause you to have a much stronger estrogenic effect and cause estrogen dominance. Okay? That's not good, guys. This is going to be more predisposing you to tissue proliferation problems or tissue growth issues like endometriosis. Like I've seen this higher in people that have had or that have endometriosis. Also, cyst formation. So if someone's forming cysts throughout their body, the cyst formation, I've seen a higher correlation of 16-hydroxy with that. Okay? Now the other thing, and it's very important, is 4-hydroxyestrogens. We know that 4-hydroxyestrogens are carcinogenic. Carcinogens, guys, are things that we know can cause DNA damage and promote cancers. So obviously, this is important to us, right? This is important to us. Now, if you're having hormonal imbalance issues, did you ever think that your gut bacteria could be contributing to the problems that you're having hormonally? The main thing that you guys need to learn, and that I'm trying to share with you guys, is that what? Everything in the body is connected. Everything in the body is connected. Your gut bacteria can cause you to have increased activity of this enzyme called beta-glucuronidase. It can throw off how your body eliminates estrogen. It can result in estrogen dominance. You can have a higher form of very potent estrogen that could contribute to tissue proliferation disorders, endometriosis, cyst formation. You could have higher 4-hydroxyestrogens, carcinogens, more predisposing you to cancers. All because of gut imbalance and dysfunction. Guys, I've talked about on these live streams so much about your digestive tract. So let's talk a little bit. Obviously, listen, we can test all these things. I test these things all the time on people. Typically, a comprehensive stool profile. Typically, I'll do these through urinary hormones, and when we do this, we typically look at the comprehensive sex hormones: estrogens, testosterone, cortisol. I look at cortisol profile with this. We look at 3 different forms of estrogens in combination with these metabolites. So you can look at the metabolites, but then we look at estrone, estradiol, estriol. We look at testosterone, DHEA, progesterone metabolites that can give you information on progesterone levels, cortisol, total cortisol, and cortisol rhythm. You look at these together. So these are basically at least 2 different tests: estrogens and steroid hormones. You want to look at when you're looking at hormones, guys. You're looking at sex hormones, estrogen, testosterone, those types of hormones. You always want to look at cortisol to see if a pregnenolone steal is occurring. Guys, if you don't know at all, you never heard that word, pregnenolone. It is a shared hormone that your adrenal glands use to make cortisol, and that your ovaries or the adrenals too will use to make sex hormones like estrogen and testosterone, and a lot of the hormones that most people will get tested and find problems with. There's a direct relationship, guys. If your adrenal glands are constantly making cortisol, then you're going to have problems with your sex hormone balance. So I do a whiteboard video. I probably recorded it. If you go to Facebook and you go to our videos tab, you'll be able to go there and you'll be able to see. It's going to be probably, I don't know, October, November, September of last year. But it says thyroid, adrenals, and hormones, maybe? I don't know. It's a whiteboard video that I draw out, okay? But it's going to be one of the first ones that I did, okay? It's a great video that will help you understand this even better, okay? Now, I'm going to talk to you guys a little bit about what you might want to consider doing right now if you have no testing or whatever to help with this. And I'm going to talk about, right here behind me, what can directly affect this, okay? And some of the strategies that we use if we find it. So, you can do testing to determine this. This can promote estrogen dominance. Obviously, this is bad. So let's talk about, with my few minutes left, what we can do here. So let's just focus again. What's the problem? The problem is that there's a gut bacterial imbalance. The imbalance can increase the activity of beta-glucuronidase. Beta-glucuronidase, which is basically this enzyme can cause you to have problems clearing estrogens from the body. That can cause you to be estrogen dominant and make you more susceptible to the problems that come with having too many estrogens. Okay? So why does this occur? Well, here's the thing. If you cannot digest vegetables very well, then you will not get indole-3 carbinol from those vegetables. Primarily cruciferous vegetables are where you're going to get indole-3 carbinol, or I3C for short. Now, some of you guys may know this is a supplement that you can purchase. Okay? I don't have it for sale. You can go to my supplement pharmacy, but I'm not selling it today. It's very interesting that this is so potent, though, guys. What indole-3 carbinol can do is it's needed for shifting. Like when you take indole-3 carbinol, it shifts your production of 16-hydroxyestrogen more towards 2-hydroxy, right? So it gives you more of that balance of the estrogens. And what happens is when your gut bacteria, you have problems with gut bacteria, you cannot digest these vegetables appropriately, and you don't get the indole 3-carbinol. So this is one of the main things that we'll do to support it. Now, obviously, guys, you want to support better gut bacteria. You can use indole 3-carbinol. Sometimes we'll use DIM, which is an acronym, DIM, to help support this. DIM, we can use DIM, which is an acronym. It's also a supplement. But guys, here's the thing. You don't want to just take these things randomly. You really, really don't. Because if you're taking any type of estrogen replacements or anything, this will change your metabolism of estrogens. So you can start taking this stuff, and then all of a sudden you feel different, right? You're no longer estrogen dominant. Maybe you feel more androgen dominant. So you really, what's the protocol really? If you're going to do a testing method, you're typically going to go test and find out what's happening, implement a plan to address gut bacterial imbalance, better digestion, better metabolism here, and then what do? You retest the gut bacteria and these problems to see if you've made the change. And then also you observe, like, oh, how does the person feel? How are they doing? That's ideal, right? That's ideal. If we don't, these things might be reasonable to consider a supplementation, right? If you don't have access to get the testing done, if you don't have the resources to do that. I can help a lot of people. We work with people all over the country. We do this stuff. This is part of just a workup with us, guys. And we don't necessarily do these tests, but we look at what's going on with the person, what kind of problems they're having, what kind of medications they're taking, get a comprehensive blood profile. We look at everything that's going on and we say, okay, what's the next reasonable test that we might want to do, or can we just implement dietary and lifestyle changes and maybe some supplements for a while? And this might be something that I would recommend, but it's not something I recommend for everyone, obviously, okay, because everyone's different, so everyone gets treated differently. But if you, so let's say you don't have access to do that, then what you do is you can consider, in a similar case, what I might want to do is have you start changing diet, right? Changing diet. So I would have someone maybe consider eating like an autoimmune paleo type diet that's higher in proteins and fats. It has higher amounts of cruciferous vegetables. Guys, the issue with cruciferous vegetables being goitrogens, or things that bind to iodine and prevent you from using iodine, is not an issue. I'm just telling you right now, in the United States, that's not an issue. I think that find research on that for me. Okay, just find research. If you're in a country where there's no iodine, then it's going to be more of a concern. But here, you would be better off to throw away your goitrogen food list, and if you're going to look at foods to eliminate all these grains and things that are much more potentially detrimental to our health, and load your diet full of the cruciferous vegetables. The cauliflower, the broccoli, the Brussels sprouts, all those things, the kale, the cabbage. Load them full of that, and I see people their health turn around all the time. Now, if some people have problems with sulfur metabolism and digestion, it can be an issue because of high sulfates in the food, and that can deplete some of their enzymes. That's getting much more complicated. But guys, diet is a good place to start with almost any problem that you're having. So like an autoimmune paleo diet's good. If you guys, I say this a lot, but autoimmune paleo is fine. It's a good place to start. You could also go through like our Hashimoto's transformation program, which is appropriate for tons of different problems, guys. We call it the Hashimoto's transformation program because that's what I work with primarily, is Hashimoto's, autoimmune thyroid conditions, autoimmune conditions. But if someone has any autoimmune condition, that program is good for them. If they have inflammation, digestive tract problems, that diet works. We've seen that work very well. So we have a dietary framework, meal plans, lifestyle recommendations. It's much more than just diet. Lifestyle recommendations, supplemental guidelines on supplements that might be beneficial, and then we have a private Facebook support group just for people going through that. So that's also reasonable. But an autoimmune paleo is something, guys, you can try on your own. So everything's connected, guys. That's all I can really tell you, is that everything's connected. I'm really short on time, unfortunately. I'm sorry, guys. If you're trying to go to our website, drbradshuk.com, it is down. You guys, it's okay. Shut down the servers. Literally, it used too much of the computer processing power that our our website host, the person that has it, makes it available for you to see, it took up to me their resources, and they notified me last night, and within 12 hours they had to shut our website down because it was disrupting the rest of their services. So it'll be about 1 to 3 days they're moving it. But I know a lot of you guys go there, and we refer you there to look at a lot of our videos because we have tons of videos and resources on all this stuff. Just go to our Facebook page at the Office of Dr. Brad Shook, go to our videos tab, and search through all the videos. You can also find me on, if you go to YouTube, there are a ton of videos on YouTube. But a lot of them you're going to find most of the ones you want on Facebook if you just go to our videos tab, and you can find them there. So a lot of the resources, you can post questions in the group. The Greater Hickory Thyroid Support Group, guys, we're streaming to YouTube here. It's just, you can post questions there. I cannot tell you for sure that we'll be able to answer it. It's gotten to the point where we cannot answer them all. And we're actually looking for partners and people that are willing to help us, that we might be able to give you access to some of our programs and things that are coming out, and give you access to big discounts on our supplementation and everything that we use. But we haven't quite figured this process out to answer all, answer all the questions in the Greater Hickory Thyroid Support Group. But I just want you guys to know I really appreciate you. I will try to do a question and answer. I was going to do a live stream yesterday, but I fell asleep putting my son to bed with him. So didn't get to do it. But guys, I hope this makes sense. Just remember, gut bacterial imbalance can throw off your clearance of estrogen from your body. Okay? Gut bacteria can throw off your estrogen clearance. Your body breaks down the estrogens into, these are called hydroxylated forms of estrogen. 16-hydroxy is very potent. 4-hydroxy is very carcinogenic, is cancer causing. This can promote estrogen dominance, which is not good. The main reason this occurs is because there are problems with gut bacterial balance. You can't break down and digest vegetables as well, so you're not getting indole-3-carbinol or I3C, which you can also get in supplementation form. Indole-3-carbinol helps to balance this metabolism and shift your 16-hydroxy more to 2-hydroxy, which is preferred type of estrogen. And this can really set you up for a lot of problems. This can set you up for all kinds of issues. And how many of you have hormonal problems, and this has never even come into the discussion? And I guarantee you it's probably 99% of you. Now, some of you are going to have been to a functional medicine doctor or someone that is more familiar with this and has given you some information, some good information. But I just want you to know that this is a major problem. This is not the only way that this occurs, by the way. So, guys, go to Facebook, our videos tab. Look at the videos there. Go back to about September of last year. You're going to find a video that I do where I talk about these, the steroid hormone pathway, which is going to it's going to explain cortisol, progesterone, estrogen, testosterone, these estrogen metabolites to you in a lot more detail. But guys, I hope this has helped you out so much. I have to leave right now. This is actually a little bit longer than I should have gone. But hopefully I'll be able to do a live stream for you guys tomorrow. Maybe I can do a question and answer. Please do post your comments down here. And guys, please share this with other people so that people can learn this stuff. Because who knew, right? Gut bacteria can basically cause issues with your estrogens because it increases an enzyme, activity of an enzyme that will shift the way you clear your estrogens. Everything's connected, guys. So please do share the video. Please give me some thumbs up and some hearts if you guys found this valuable. Post your questions here. We will try to answer you guys as much as we can. If you guys need help, when our site's back up, you can go back to drbradshook.com. We have tons of resources. If you guys are just confused, consider doing a consultation with me. Like I do phone and we do distance consulting. I work with people all over the country, around the world. But you can do Skype or phone call, and we can do a 15-minute consult where it'll be a strategy session. You say, hey, we just go from the beginning. I'm just like, okay, tell me what's going on, and I'll give you all the information and advice I possibly can. Oh, and by the way, you can get the Hashimoto Transformation Program if we do for those consultations right now, too. So if you make a consultation, it's thyroid consult. I think it's thyroid consult. Thyroidconsult.com. Just go to thyroidconsult.com. You can make a consultation, schedule a 15-minute consultation with me, and we're gonna give you all kinds of stuff. But we're just trying to get information out to you guys, teach you how to take your health back. You know, you can always start with diet yourself, but we're here for you if you need us. And I really appreciate you guys so much. Thank you for being part of our community. Thank you for your interest. I'm so glad that this stuff is helping people. So just ask any questions you have, post them below, and we will get back to you because I got to run. Appreciate you so much. I hope you have a wonderful, wonderful day. Thanks. Hey guys, Dr. Shook, thank you for viewing our videos. I hope they help you out. If you want to, just subscribe to our channel somewhere here. You can watch a video that YouTube's actually selected for you, so hopefully it'll help you out. If you need any other information or resources, just look in the description. We've got links to our website, to our 9 lab test guidebook, and everything else that we do. I really appreciate you, and I hope you guys have a great